and welcome back to our YouTube channel. My name is Zaina and today I will be busting all those myths and misconceptions that people have about the subject psychology and about us psychologists. Number one, the first thing that everybody has always asked me or said to me when I say that I'm a psychologist is, can you read my mind? Well, the answer is no. But what we are trained to do is to pick up on subtle cues of an individual, of the opposite person, of an average individual if you want to call them that. We are trained to look into their behaviors, their facial expressions, their non-verbal cues, and that is how we can so-called predict what they are thinking, what they could be possibly feeling, and how they might possibly react. And that's about it. We don't read minds. It's as simple as that. Number two, psychology isn't a real science. That is something that it is an age-old debate. Is psychology an art? Is psychology a science? What is it? Now, before I get into what it is, what exactly is science? Now, according to Google and according to a lot of things, science is the use of empirical methods, the use of research, the use of statistical tools, the use of objectives and hypotheses. In psychology, we use all of this. We use empirical methods, we use experiments, we use hypotheses, we use objectives, and we use proper statistical tools to make sure what we are doing is right. And these experiments can be replicated in the future for people to know if they want to ever replicate a certain study or a certain experiment or a certain result. So, psychology is definitely a science, right? Now, number three, psychology is easy and it's mainly common sense. So many people have said this to me, so many people. Psychology might be easy, psychology might be common sense. But is common sense really that common? Is common sense really that easy? Do we tell people that English is an easy subject? Yes. But do you know what all goes into English? About every time, about literature, about the whole language in itself. If you ask a linguist and ask them and tell them that English is an easy subject, they will throw something at you, and so will I. If you tell me that psychology is easy. We have so many theories that we have to study. We have so many people in the field of psychology that help us understand what psychology is and how it is going to be in the future and how it is right now. We do so much learning in psychology like you do in any other subject. You don't go and tell an engineer that his subject is easy. Why do you want to come to us and say that our subject is easy? It's as simple as that. Now, the next thing, going to a therapist means that I'm crazy. No, going to a therapist means that you are taking care of yourself. We are all selfish people. Eventually, that's what it boils down to. And if I am taking care of what I feel, the way I think, the way I behave, that does not make me crazy. That only means that I want to get help for myself. Self-care. When somebody has a fever, when somebody has a cold or a cough, they go to a doctor. Does that mean that, going to a doctor means they are completely, wrong in going to a doctor? It's the same logic that you would put into this. Going to a therapist, going to a psychologist does not mean you're crazy. It only means that you're looking after yourself. Or if you're sending somebody to a therapist or a psychologist, it means that you care for this person. Now, the next thing. People with mental health problems are violent and unpredictable. I understand why people might think this. It's about what we read, it's about what we see in TV, in television serials, in movies. The portrayal of a mental illness equals violence / crazy / completely unpredictable behavior, right? But I'm here to say otherwise. Mental illness does not necessarily mean you are violent or unpredictable. Yes, there are certain types of mental illnesses that can have this kind of behavior, can have a violent type of behavior, can have an unpredictable behavior. But let's say statistically, that is not what it is. There is a very small population of individuals who have a mental health issue, who have a mental illness, that are antisocial. According to studies, the general population is way more violent and unpredictable than people who have a mental illness. Very difficult to understand? No, it's not. Google it, you'll know. The next thing, therapy and self-help is a waste of time. Why bother when you can just take a pill? Because that's what you would do if you have a fever or a cough or any kind of a physical illness, right? What I'm here to say is, the treatment of mental illness is a combination of both therapy and medication. Sometimes some people can do well with just therapy, but most often than not, you need a combination of both of this to help you get through what you are. Now, the last thing that I want to talk about is the difference between a psychologist and a psychiatrist. Often I am mistaken for a psychiatrist. The minute I say I'm a psychologist, number one, can you read my mind? Number two, can you give me medication because I get anxiety and panic, right? Now, here's the most simplest, easiest difference between a psychiatrist and a psychologist. A psychiatrist learns medicine. They do an MBBS, they do an MD, and they are legally allowed to prescribe medicines for you. A psychologist, on the other hand, is trained to provide therapy for you. They need a minimum of a master's degree for them to practice in behavioral problems and to help you out. Now, there is also a clinical psychologist and a counseling psychologist. What is the difference between these two? For you to be called a clinical psychologist, you need an MPhil in clinical psychology, and for you to be called a counseling psychologist, again, you need an MPhil in counseling psychology. And if you want to practice as a counselor, as a clinical or a counseling counselor, counseling psychologist, you need to be registered under the RCI. You need to have a license number, just like how a doctor has a license number. Now, these are the most common myths and misconceptions that I have come across as a psychologist. If you have some more that need to be answered, comment down in the comment section below and I'll try my best to answer them. Don't forget to like, comment, share and subscribe to our YouTube channel because I'm sure we will come out with more for you. Bye-bye.